Hi, this is Dr. Sundari Mace, Sonoma County's health officer. I'm here to share your daily update on COVID-19. So our numbers have increased. As of today, we have 136 total cases. 83 of those are active, 52 have recovered, and we've got one death. We've done nearly 3,000 tests at this time. So you might be wondering, how is it that we got 16 new cases? Well, as I'd mentioned the other day, we're doing some really intense contact tracing. That means that we're finding out who had contact to our cases and following them really closely and testing them all, people who are symptomatic and people who are asymptomatic. So I'm really happy to say that the majority of cases that we have now diagnosed are in those contacts that we prioritize for testing. So we totally expected to find this result. And the good news is that we are moving towards finding more and more cases in these contacts, which is exactly what we expect. In other words, we're not seeing as many cases in people who traveled, since nobody is really traveling at this time. And also, we're not seeing those many cases in people just popping up in the community, and we don't know where it came from. So we're going to continue this strategy of close contact tracing. In other words, when we find somebody who has COVID, we ask them who they came into contact with during their time when they were symptomatic and 2 days before they developed symptoms. And then we follow up those cases, test them to see whether they're positive or not. Now, we take one question daily from the general public, and many people are asking, why is it that our modeling shows that we'll have a peak of cases and hospitalizations in late May or early June when other people have actually projected different times? Well, our model is very specific for our county, so it's taking into account our case numbers, our demographics, the fact that 70% of our population is in urban settings versus 30% in rural. So things that are very specific to our county. Plus, take into account that we had our first case later than counties down south from us. In other words, we put our shelter-in-place order into effect when we had just a handful of cases, whereas other counties had many more cases by the time they put their shelter-in-place orders in effect. So that may also impact when we're going to see that increase in case numbers, or what we're calling a surge. So we'll keep updating you on the modeling and look forward to speaking to you again. Thank you very much.